We came here to work with the Bihar government on the management of Kala-Azar disease. And later MSF realized that there's a lot of correlation between Kala-Azar and HIV. When MSF went into this, they realized that there are this group of HIV patients who have advanced HIV that nobody wants to take care of, nobody wants to provide medical care to. And there is really a good chance of these patients for surviving and coming out of being advanced HIV to a more stable state of HIV to be able to carry their routine activities. So this motivated MSF or propelled MSF to put up a system, a health system like this that can focus mainly on advanced HIV.
Advanced HIV is a new concept. It has come out of regular treatment of HIV. When the word HIV, when the treatment of HIV has become normalized and has taken on a programmatic outlook, the people who fell through the cracks are the ones who end up as advanced HIV patients. These are the patients who present with severe infections, who present with advanced stage of the disease, and they usually present quite a bit late for treatment.
So as we know that the caseload is extremely high in Bihar, so we have a small facility set up in the capital of Bihar, that is in Patna. So we usually get the patients from the 5 antiretroviral treatment centers.
They get consulted by a doctor and a health promotion team, after which lab personnel visits them for blood draws and other investigations. If needed, if the doctor feels that it's necessary to take it further, to test it further, we offer radiology services.
As we started to treat advanced HIV patient in Feb 2019, after 3 to 6 months, we observed that most of the resources or budget are being spent under the second and third level of antibiotics like meropenem and others. The reason being is that majority of the patients were already on the several antibiotics. Therefore, to treat those kind of patients needed higher level of antibiotics.
Before we start a patient on antibiotics, we try to use the laboratory, take samples, investigate, confirm the presence of the bacteria or the microorganism, which microorganism is that, what is it culturing, what drug is it sensitive to, and then following that we are able to start providing antibiotics to our patient.
After the implementation of the ABR model of care, we have seen many positive outcomes. It has reduced the length of hospital stay of the patient with efficient use of accurate antibiotics. Before model of care, the average length of stay was 10 days, now it is only 7 days. It also minimizing the toxicity and adverse drug reaction related to antibiotics. It significantly reduces the unnecessary prescription. And now we optimally use budget and resources compared to the early phase of the project.
So one of the reasons why we wanted really to bring in the ABR aspect is to really demonstrate the benefits of proper use of antibiotics. There must always be a reason for me prescribing an antibiotics. So we were using less antibiotics. This never affected our mortality. Our mortality continued to decline, which was really good. And only patients who really were confirmed to have bacterial infections were put on antibiotics.
We also allow one caregiver to stay with the patients to take care of the patients. And it is very important for us to talk to the caregiver as well as the patient as to try to know the social factors, the fabrics.
If you look at the NFHS survey phase 4, you will see the knowledge about HIV/AIDS is very low, within a range of 20 to 40%. And stigma comes out of perception, right? And it comes out of moral judgment. So for the at community level, they perceive these people, as a scum in the society. And they try to ostracize these people because of their stigma.
we help the patient in coping with the marginalizations, that they have experienced, not just like, the society or the community at larger, but also at their home facility itself. So our motto is not just to reduce the level of anxiety and depression, but also to give the controllability and the predictability back in their hands, so that they can deal with the future and the current stresses that they are going through. So that is a platform where we created, where we provide not just the individual sessions to the patients, but also a lot of mental health support goes into helping the family members as well.
So we are here not only to treat their illness, but we are here also to cater their mental health need, the psychosocial need, and we are trying to provide them the best nursing care that they ever get in Patna.
So we work together with all the departments, with the nurses, and then with the doctors as well. So this is our kind of holistic support of healthcare.